All right, in health news this morning, how does a midwife's role in women's health care differ from others? Spectrum Health is celebrating Midwifery Week, September 30th through October 6th, and the expansion of the midwifery and OBGYN practice. And joining me this morning is Courtney. Good morning. Thank you so much for being here with me.
Happy to be here.
Yeah, great. Okay, so what is a midwife?
So a certified nurse midwife is a nurse who has advanced training and a master's degree in nursing and in midwifery, which is the practice of being a midwife. So midwives take care of women from all through their adult life and provide care during childbirth, pregnancy, postpartum, and then for routine gynecologic needs and family planning needs as well.
And why do some people choose that option of care rather than just, I guess, I don't want to say typical OBGYN,
that's
but
okay.
I mean, however you want to state that.
Some women choose nurse midwife for their pregnancy if they're looking for a more holistic approach. If they're looking to have a natural childbirth, that's something that that nurse midwives are expert in helping women accomplish. And for women coming to a nurse midwife for gynecologic care, just looking for that holistic approach and that education that you get from a nurse midwife.
And this is something that actually people will find at Spectrum, correct?
They will, yes. People are often surprised to hear that we have over 20 nurse midwives at Spectrum Health, both in our Grand Rapids locations and some of our regional locations, such as Pennock Hospital in Hastings, Gerber Hospital in Fremont, and then here at Butterworth Hospital in Grand Rapids.
So I know that my sister actually used a midwife for one of her pregnancies, and actually she went to the hospital like normal. So explain, I guess, when it comes to them delivering, it's not like they come to your house, or can that be an option? You know, how does this work?
Generally, nurse midwives deliver in hospitals.
Okay.
There are nurse midwives that do provide home birth services, but at Spectrum Health, all of our nurse midwives deliver in our hospitals and help women achieve a normal childbirth. And then we consult and collaborate with our obstetricians if needed for a cesarean or any other high-risk parts of the pregnancy.
Okay, so I think people probably have a few more questions out there, and you guys have a great event coming up where they actually can have some one-on-one time to talk about some of the questions they might have.
Yeah, we're excited about a new midwifery office we have in Grand Rapids at 426 Michigan, and this week we are having a free open house at our office to meet the 4 midwives that practice there. Those 4 midwives work with 6 obstetrician gynecologists as well in the practice. And it's from 5:30 to 7 this Thursday night.
Okay. And as we, we've talked a lot about the pregnancy aspect of things, but you said this is adult women, all aspects of types of things that women are dealing with.
Yeah, and a lot of times women will come to a midwife for their pregnancy and then just continue to go to that nurse midwife for their annual checkups or for their family planning needs. And so it really can be a relationship that lasts throughout a woman's lifetime, her partnership or her relationship with her midwife.
Wonderful. Okay, so once again, let's go ahead and get the information back out there for that event, because I think it's really important that people know that this is taking place. So details, if you want to run back through them once again on the screen.
Great. On October 4th from 5:30 to 7 p.m., we're having a Meet the Midwives Night, which is at 426 Michigan Street Northeast in Grand Rapids at the Spectrum Health Midwifery and OBGYN practice. This event is free and open to the public and is a great chance to meet our 4 nurse midwives at the practice.
And this isn't anything new. This is something that's been around for a very long time, correct?
It has, yeah. And Spectrum has actually had nurse midwives delivering for over 20 years. So it's new, or it's not new, but we have expanded our number of nurse midwives a lot in the last 3 to 5 years.
Wonderful. All right. Well, thanks so much for stopping by.
Thanks for having me.
Yes, sure. All right. And to make an appointment, you can give them a call at 616-391-3302.